Aloha, everyone, and thank you for joining the COVID-19 Public Health Action Webinar, COVID-19 Lessons Learned from Public Health Nurses. My name is Roella Ferranda, and I'm the Programs Director at the Hawaii Public Health Institute. Before we get started, there's some Zoom housekeeping to go over. For all questions, please utilize the chat box or the Q&A or questions and answers box located at the bottom of your screen. There will be no continuing education credits provided during this webinar series. All webinars will be available on the Hawaii Public Health Institute, Hawaii Public Health Training Hui's YouTube channel. We can drop the link into the chat for easy access. Without further ado, I would like to introduce you to our presenters for today. Jody Sanara. Jody has been working with the Hawaii Department of Health Public Health Nursing Branch for the past 16 years and is a supervisor for the West Honolulu Public Health Nursing Section. She is a co-lead for Public Health Nursing COVID-19 Community Outreach. Holly Kataoka has been working with the Hawaii Department of Health Public Health Nursing Branch for the past 13 years and is a supervisor for Central Oahu Public Health Nursing Section. She is also a co-lead for Public Health Nursing COVID-19 Community Outreach. Please join me in giving Jody and Holly a warm virtual welcome. I think you're muted.
Okay, let me just go ahead and share my screen here. Okay. First off, do you see that here? Okay, great. First, I'll be going over what public health nurses do, our mission and vision and values. Next, I will be moving on to talking about community outreach and how we do it. After that, Holly will be taking over and talking about the most frequently asked questions we get on our outreaches and finishing off with the lessons we have learned on our journey so far. Public health nurses are in every community statewide. We have public health nurses on islands. Much of our work is done outside within our communities. This gives us the opportunity to interact and engage with the people that we serve. Here are some pictures of our public health nurses in action. They are participating in an array of activities such as COVID-19 pods, which stand for point of dispensing, COVID-19 testing and vaccination clinics, health fairs, outreach to the homeless on the beaches, and working with our elders in elderly housing. Public health nurses strive to improve the health of individuals and families through interventions such as increasing access to healthcare for the vulnerable populations, educating about how to prevent disabilities related to chronic conditions, and investing in healthy lifestyle choices. Values that guide our practice are caring, being concerned about the health and well-being of others, making people feel important. Humanistic, being supportive and responsive to others' needs. Diversity, accepting of differences in lifestyles and values between individuals, groups, and community. Honesty, being truthful, trustworthy, with an upright character. Teamwork, working in unison toward a common purpose. And purposeful, having a clear mission with goals and objectives and a commitment to the delivery of comprehensive quality nursing care. As public health nurses, we would like to see health equity for all people in all communities. According to the Robert Wood Johnson Foundation, health equity means that everyone has a fair opportunity to be as healthy as possible. Equity is not the same as equality. In equality, everyone is given the same amount of resources or opportunities. For example, when educating someone about COVID-19, 2 individuals will be given a brochure written in English, even though one of the individual's first language is Japanese. On the other hand, in equity, the persons whose first language is Japanese will also be offered an interpreter who can speak their language and be given a brochure written in Japanese. Public health nurses primarily work with communities that have health inequities or unfair health differences closely linked with socioeconomic or environmental disadvantages, such as poverty or lower educational levels. One way that public health nurses work towards this goal of reducing inequity related to education is by tailoring our clients' educational plans with their needs. For example, one client may need more frequent visits with a public health nurse, interpreter services during that visits, or more connections to other community partners than another client. We listen and respond to our community's needs. As a public health nurse, we don't assume that we know what a particular community's needs are before we do an assessment. We look to our assessment, which includes information from key informants or people that live in the community and community leaders to help us identify what the intervention should be done. For example, when we work with our elder populations, we conduct a survey of their needs that will help us determine what to focus our education on. Once the interventions have been decided, we implement and evaluate. From there, we identify any areas that can be improved. This is our performance management model in action. Collaboration is the key. No one entity can do it all. So we look to partner with our other community partners and members that are also invested in that particular community. Working together towards the same goal makes the process more efficient and enhances productivity. Building capacity. As public health nurses, the goal is to work with our community partners and members to be able to take care of their own self and their community without public health nursing involvement. This signifies a more permanent solution to that identified need. Next, it brings us to community outreach. Working in collaboration with the Department of Health, our outreach targets communities that have had lower COVID-19 vaccination rates and higher positivity rates. Our goal is to mitigate the spread of COVID-19 by educating on the importance of personal protective practices, such as hand washing, staying home when sick, practicing social distancing, and wearing face masks, and most importantly, answering any questions that the public may have. Since the start of our outreaches in May 2020, we have completed over 160 outreaches with over 1,900 hours of PHN time that have been devoted to educating our communities in person and door to door. These outreaches would not have taken place without the collaboration of our partners, Hawaii Public Housing Authority, Hawaii National Guard Medical Task Force, Medical Reserve Corps, Hawaii Public Health Institute, Hawaiian Homelands, Queens, Hawaii Pacific Health, Kaiser, Project Vision, Wahiawa Health, and Castle, just to name a few. Before we outreach to any community, we do an assessment. We identify the key informants of that community so that we can get the most credible information from them. This is to ensure that we are utilizing the appropriate tools for that community. For example, if we find out that a community has a lot of Vietnamese speakers, we take translated flyers in Vietnamese language and a Vietnamese interpreter that can accompany the public health nurse to speak with the resident. Assessment of the physical environment is also important to identify and plan for any safety hazards that may be encountered during an outreach. Some of the things that we make sure to look at are the road conditions, streets, traffic, and the presence of pets. Safety of our outreach team is our #1 priority. Once we obtain all the information from the assessment, We formulate our plan for the outreach. We finalize the logistics such as staging areas, parking, approximate number of apartments, homes in the development, and how communications will take place between the teams with the home base. In the past, we've used cell phones and radios. Another important thing is good communication is important between community partners to ensure a successful outreach. All partners should meet together to discuss their issues or concerns during the planning stages and have access to each other's contact information if changes need to be made at the last minute. Making sure that everyone is clear on their roles and responsibilities before outreach commences is a must-do. We do a pre-briefing that includes just-in-time training that goes over all of the logistics for the site, safety plan, explanation of the data collection sheets, and all informational handouts we have on our clipboard for that outreach day. After all the coordination and planning for the outreach have taken place, we finally get to talk story. So when I go on an outreach, I usually open up the conversation by saying, "Hi, my name is Jody. I'm a public health nurse from the Department of Health. We are in your neighborhood and community today to answer questions about COVID-19. What questions do you have for me?" Sometimes I'll get a question right off the bat. Other times it takes me listing more specifically. Do you have questions about quarantine or about isolation, about symptoms or testing? However, usually after that first question has been asked, the conversation will flow from there. The longer the conversation goes on, the more possibility for the rapport to be built. Other times I'll get people who don't want to talk to me, and I'll say, "Thank you for your time. Respect their wishes and leave." They may not want to engage this time, but there's always an opportunity for the next time. So I would like to introduce one of our awesome public health nurses, Lance, who will provide his perspective on outreach.
Hi everyone, I'm Holly. So I'm going to be taking over from Jody and going into questions we've encountered on our outreaches and just some lessons that we've learned along the way.
Sorry, Jody, pause. The Lance's video couldn't be heard. There was an audio problem.
Oh, shoot. Okay, hold on. Let me try again.
Please, thank you. No, not yet.
Sorry, I'm not sure what's happening.
Maybe you can turn your volume up and then.
The volume's all the way up.
Oh, it is.
Yeah. Oh, darn. We need technical.
Okay.
Maybe we can try putting it on at the end.
Yeah.
Yeah, or we can also share it post presentation.
Okay.
We
One of
cannot.
us will work on it and then we'll just continue with our presentation then, if that's okay.
Yes, mahalo.
Okay. So let me try my best. I'm continuing. Okay. So like I was saying, we'll go over some questions. So meeting people where they're at has been key to our success with outreaches. Our collaborative efforts with our partners have taken us to many community events that include testing and vaccination clinics. Our efforts may look different in every community, but serve to bring resources, education, and support to all people to achieve their best health. These events have allowed us to talk story with people and answer questions in a non-threatening environment. Some of the questions we've encountered are, how much does the cost? How much does the shot cost? We assume that everyone knows, but this question helps us to remember that reinforcing the information of cost is important. We let people know that the vaccine and or booster are absolutely free. Residents worry that because they do not have health insurance, they will not be eligible for the vaccine. We try our very best to inform them that the vaccine is paid for by taxpayer dollars and will be given to everyone living in the United States, regardless of health insurance or immigration status. Then where can I get the vaccine? As Jody mentioned, our focus is on communities with low vaccination and high positivity rates. When planning outreach, we always try to work with a provider to offer on-site vaccinations. If this is possible, we encourage residents to receive their vaccine on-site. We'll even accompany them to the registration table to help answer any additional questions they may have. Sometimes they'll wait for their families to arrive home and then get vaccinated together, which is probably a good idea for all of them. By offering outreach and vaccinations together, we're making attempts to address health equity for all people of this community. If there's no on-site vaccination clinic, we'll provide the residents with either a flyer or handout with nearby vaccination clinics, and also refer them to the DOH Hawaii COVID-19 website. We created a QR code that residents may scan with their phone to make it easier. How come I got sick from the shot? We'll ask them what types of symptoms they experienced. Majority of the time, the symptoms are side effects from the vaccine. We'll talk them through the symptoms and also refer them to their own primary care physician for additional information, especially if they have underlying health conditions. We want to assure that these residents keep open lines of communication with their physicians in case they have additional questions later on. They'll also ask, why I gotta get the booster shot? This is a very common question. We explained that no vaccine is 100% effective. A booster dose is designed to boost their immunity or make it stronger against COVID-19. This increased immunity will provide better protection against getting COVID-19. In addition, we also try to remind them that there are other vaccines that also require boosters to achieve immunity. And then they'll ask, when should I get my booster? We provide the latest information possible. This particular question has caused some confusion, with the CDC having shortened the booster interval from 6 months to 5 months to those who completed their primary COVID-19 series with either Pfizer or Moderna vaccines. Recently, what we did, we made a simple reminder slip that provides them, the residents, with a date they'll be eligible to receive their booster. And then some general questions that they'll ask is, if I get the vaccine, can I still get COVID-19? This answer is similar to the one regarding the vaccine itself. In this case, if a person was fully vaccinated and got COVID-19, then it would be considered a breakthrough infection. Using terms that are heard in the media help residents to understand information that is being shared out there. We reinforce that there is no vaccine, again, that is 100% effective, but those who have received the vaccine will usually experience milder symptoms. The vaccine is also effective in that it can help prevent serious illness, or in some cases, death. What do I do if I get COVID-19? We stress the importance of staying home in a separate room and away from other household members. We'll refer residents to the DOH booklet, Home Care for Persons with COVID-19. This is a comprehensive resource that will assist residents in developing a plan, writing a list and contact numbers of their support system, give them an overview of COVID-19 and many other subjects to help these individuals take control of this infection. The booklet is provided in English and several translated languages such as Chuukese, Ilocano, Marshallese, and a few others. On our outreaches, we usually carry a sample booklet with us to show the contents, and we'll even give it to the residents if they are unable to access the booklet online. We've created a QR code sheet for this booklet also that residents can scan to link them to their preferred language. Along with this booklet, we provide another resource. It's the Take 10 guide. And then this brochure lists and shows pictures of 10 essential items to have in your home in case of a health emergency. The primary reason for this brochure having been created was to provide information about emergency preparedness in case of disasters and sheltering in place. The brochure serves a dual purpose for emergency preparedness and preparation for COVID-19. They'll ask, what is the difference between isolation and quarantine? This is also explained in the Home Care for Persons booklet. We explain that isolation is for a person who tested positive or was diagnosed with COVID-19, regardless of vaccination status. Quarantine is for a contact who has been exposed to someone with COVID-19. And they'll also ask, where can they get tested? We try our best to provide specific sites for residents to get tested. If we're aware of upcoming events in their community, we'll share that information. But if not, then we'll refer them back to the Hawaii COVID-19 website for the most updated information. And for this, we've also created a QR code sheet for them to scan. And then the home test kits. We always get this question about where can they get them? So we've actually been fortunate over the past few months to have received home test kits to share with many of the communities. It was a great icebreaker for us to engage in conversations with them. Currently, we're sharing the website covidtest.gov to encourage ordering of 4 free test kits per home. Then these are just examples of resources that are also available at the hawaiicovid19.com website. The summary guidance for COVID-19 cases and contacts, and this is translated in other languages. The COVID-19 return to work guidance, the Home Care for Persons with COVID-19 booklet that I had mentioned, also available in other languages, the Take 10 Emergency Preparedness Guide, and also the When Should I Get a Booster, also available in translated languages. Some of the lessons we've learned during outreach. When we started our COVID-19 journey, we were concerned with the safety of our communities, but also including ourselves. The community was fearful of COVID-19, but so were we. We needed to acknowledge our own fears in order to educate and serve our community. Recognizing our own fear helped us to engage in meaningful conversations with residents. There was a commonality that we shared. We were spreading awareness and education in a community that we're a part of. Over the past 2 years, our outreach has morphed with the introduction of vaccines and changes in attitudes and behaviors. Through our joint efforts with our Department of Health groups and many community partners and community members, we have witnessed changes such as increased mask usage. So previously, we would ask residents if they had a mask, and if so, ask them if they could please put it on while we talk. We would also provide them with a mask if they didn't have one. Currently, when we knock on their door or call from the sidewalk, the resident will ask us to wait while they put on their mask before coming out. Such an awesome experience for us to have seen this. Increased physical distancing, just as mentioned regarding the mask usage, the same holds true for this. Residents are aware and providing the 6-foot physical distancing when conversing with us and with each other. When we see them talking to their neighbors, they seem to hold that 6-foot distance between them. Necessity of in-person language services and translated materials. Outreaches have confirmed the importance of having interpreters on site whenever possible and translated materials available to residents. We have had the luxury of having interpreters as part of our outreach team for residents who spoke little to no English. The educational message to residents the interpreters have been valuable in translating our educational message to residents on our behalf. We are also able to reinforce that translated materials are available on the COVID-19 website. And increased rapport and trust with residents after repeated visits. This rapport and trust that we have built with many of the residents have been rewarding for us. Residents recognize PHNs, MRC, National Guard, Hi-Fi, and many other community members when we enter their properties on the second and even third visit. At our latest community outreach, residents recognized us by our PHN teal scrubs and would proudly display their vaccination cards to us as we were approaching their front doors. The point where we are at today has taken the dedicated efforts of DOH, PHNs, MRC, National Guard, Hi-Fi, and many other community partners. I'm sure many are aware of the saying, it takes a village to raise a child. Hold on. Sorry. This has been a team effort of collaboration and dedication to protect and keep our communities healthy. This saying also is a reflection of our COVID-19 outreach efforts. The ability to provide awareness, education, encouragement for vaccinations, and a general ear to hear residents' questions and concerns has taken a joint effort by many partners throughout the past 2 years. PHNs are part of an amazing team that includes, but not limited to, DOH Disease Outbreak and Control Division, Disease Investigation Branch, DOH Communications Branch, Office of Public Health Preparedness, Hawaii National Guard, Medical Reserve Corps, Honolulu Fire Department, Honolulu Police Department, Hi-Fi, and many more community partners. Together, we are not only educating, but also building capacity within the communities by empowering them with knowledge and resources to take care of each other and keep their community healthy. We continue to remain flexible with our outreaches as information is updated and availability of vaccines and testing become more accessible to residents and families. Residents appreciate handouts and or the QR codes that refer them to our DOH COVID-19 website for additional information. The website provides a great baseline for consistent messaging that families may share with their family members, neighbors, co-workers, and general community members. The DOH website also provides links to translated materials that enable families to also communicate with each other. The education provided does not end at the door, but is rather the beginning to a wealth of information available to them through our website. I'm going to try and start this. Okay, we're going to try and share this, but I wanted to introduce one of our amazing public health nurses, Kavehi. She's been involved with many of our COVID-19 outreaches, and she's going to be sharing one of her experiences in the community. This one? Okay. Sorry.
It's very light. Yeah, we can barely hear it.
Okay.
But maybe you can summarize what she's saying as an alternate, and we can send the video along in our Mahalo email after the webinar. What do you think?
Okay. She was talking about an experience that she had in Nanakuli. She had encountered an auntie, as she refers to her as, who I guess was hesitant to receive the vaccine. And so after some talking, and sharing of information, then she had come around and gotten the vaccine. But it does, I think in her, in Kavehi sharing, she also talked about how when we go into a home, we think, oh, we're going to be there a few minutes, but then it may be a little longer. Sometimes it goes for 15, 20 minutes. And some of us have also experienced longer than that, for 30 minutes, but it's worth it. All of it is worth it because just one more person getting vaccinated helps keep our community safe. And not just for that person, but for everyone around us. So hopefully you folks can see that video when you go back and you look at this. So I'm gonna share the next one. Oh, okay. So before we go, just a few takeaways. Public health is the responsibility of all of us. We all are in this together. We always listen and respond to our community's needs. It is through the collaborative efforts of all of us working as a team to educate our communities on health issues. We work towards building capacity and empowering our communities with knowledge to care for each other and live in a healthy community. So that brings us to the end of our presentation. These are our contact information for Jody and myself. Feel free to email us with any questions, or if you have any ideas about outreach that you'd like to share. And then also, this is the website for our Department of Health resources. Thank you.
Mahalo. Mahalo, Holly and Jody, for such an informative presentation. We did get some questions that floated through the chat and the Q&A box. So hang on, don't run away. Okay, so one question is, how many public health nurses are there in the state? And how many of those nurses speak multiple languages, such as Ilocano, Chuukese, Spanish?
I don't know the number offhand of how many, of how many PHNs are available statewide. There are many of us. I want to approximate 70 or so, and we're on all the islands. And there are many who do speak different languages, Japanese, I think there's Korean, Ilocano, Tagalog,
Visayan,
yeah, Hawaiian, so several, yeah, and they will assist Vietnamese, and they will assist on outreaches, or not even only outreaches, but even when we need help in our offices with questions that come up from the community. Yeah.
Yeah. Thank you. And to access or reach out to public health nurses, would we just go to the Department of Health website, or how do you recommend folks communicate with public health nurses?
Well, if it's questions regarding this presentation, by all means, use our contact information, Jody and Holly on here. If it's more general questions, we do have a website on Department of Health, Public Health Nursing Branch, which kind of explains what I went over earlier about what our core values are and what we stand for. So if they wanted more general information, they can go there. Anything else?
No. You can end your screen share as we continue to go through some of these questions. Next question is, what type of activities did you do to outreach to the Compact of Free Association, or Kofa, population during the pandemic?
So within a lot of our outreaches, we had a various amounts of different ethnicities, and Kofa was one of them. We've been through partnership with the Hawaii Public Housing Association. We've been through many different public housing, all the way Waianae, Wahiwa, many in Kalihi, various, and there have been many from that Kofa population that we've spoken to. We also were benefited by our bilingual services that we have here at Department of Health, and they were able to come out with us. So we did have Chuukese speakers, interpreter, Marshallese, and other language.
Yeah. And so we did reach out to them at the housings, but also we've been involved with vaccination and testing sites. And so we were actually at the stadium for about a 5-month period. And so we did see different populations. And so we provided education at the testing site. And that was one way we reached out to them. And if we didn't have anyone on site who could translate, sometimes we would have access to them through audio, through our telephones. We were able to access translators to assist us.
And through our outreaches, we've also, we're lucky to have our DOH communications office working hard on all the translated materials. So we've had Chuukese, Marshallese, and all of that kind of translated materials with us on our outreach. So, if by that chance we didn't have an interpreter in person that day, we would have translated materials with us.
Great, thank you. Next question is, during the pandemic, what resources have been most requested from public health nurses?
I think for me to start off, and then Holly can finish, I think all of the resources Holly went over during her time in talking about testing, so that we had the most common questions that were being asked. And from there, we've included, basically from what our community outreach we found, we've included that information. So at first it was all about testing and what was COVID. And so we had handouts on those things within our repertoire of items that we were handing out. What else to say?
In addition to that, when we first began outreaches, especially at the Hawaii Public Housings, they provided masks, and they provided hand sanitizers for us to share with the residents, which was very helpful because I think in general, it was in short supply. So the residents were appreciative of that. And I think, like we had mentioned, it was helpful in breaking the ice and talking to residents. So that's why there have been many hands in our outreaches who have helped us to be successful.
Thank you. You mentioned in your presentation that conducting assessments prior to going out to a community, learning about the community before finding solutions was critical. Do you have any tips on creating an effective survey to gauge the needs in our community?
Really, I can start off with that. So I think it really depends on the type of discussions that you have with your community key informants. Those are people that, who live in the community. And some of the community leaders and other people who are also community partners that are invested in the community. Because through that, it kind of shows you where to go. It kind of asks you, it kind of tell you like what kind of questions to ask. It kind of gives you that picture of where you want to take it. So I think through that discussion.
Community leaders are important, and also the programs that are in the different communities, and food distribution. Those who help with the food distribution, they've reached out to us also in different communities for our assistance.
So very listening and responding to your communities, basically. You want to listen to those leaders and those key informants. And then through those discussions, I think a picture will come out. And then you kind of know what kind of things to ask the rest of the community.
Thank you.
Hope that answers that question.
I think you did. You want to be intentional before you go into a community. So you did. Next question is, how would you define successful outreach, or how do you measure the success of an outreach event?
In the beginning, we were doing a survey to help us gather data. And then things progressed because we would go multiple times to the same site. And I think reinforcing the messaging. So sometimes the residents were feeling overwhelmed because there was social media, there's seeing things on the TV, reading the newspaper, and just in general, talking to people out in the public. So I think it can be overwhelming for them, but having the one-on-one conversations, you could see the success come through. And that was one of the things we shared, was that when we returned to a specific site and we saw them that they would now wear their mask, or they would practice the social distancing, we would consider those as successes, not just from us, but I think from the information they're receiving through social media, like I was saying, through TV. So just that reinforcement, we would call it a success, because it's very different when we go back. They're very receptive, and they have different questions that they have, not just general COVID-19 questions, but specific about boosters, about testing sites, and those types of things.
So like quantitatively, Kali had described, we were taking a lot of the data collection that way, by how many people that we were seeing, how many we were talking to, what were we educating on. So that's what we were measuring prior. And then, but we also take a look at the qualitative too, which is the stories and the actions and behaviors that we have seen changed. And that is kind of what we outlined, what we saw with our lessons learned. So that's kind of how we measure quantitatively and qualitatively with a collection of all of that data to put together.
Perfect, thank you. Next question is, are you accepting referrals from the community to provide assistance to seniors?
Yes, yes, we always accept referrals to provide assistance for we have we see the newborns all the way to the elders. So yes, we do on our website. We have a PHN10 referral form. So if they're speaking of more of individual clients, we take those also. Or if they have a need for more group educational trainings, that we do also. Just need to contact us.
Great, thank you. I wanted to open it up to you and see if you had any personal stories or stories from other public health nurses from your outreach, and where some of them changed their mind on COVID-19 safety measures, vaccinations or testing. You mentioned that, the CDC communication has been a little bit confusing. So maybe share a little bit about that.
I think for us, I think, there are particular stories that kind of stand out. And I know there was one, when we were at the stadium, we were doing the testing. So we were helping at the checkout. And so we educate, right? And then on site, fortunately, there was vaccination there. And so when we give out the results, whether it's negative or positive, we'll talk to people. And I know one encounter, I had given a negative result to someone. And so because their result was negative, I had just asked, have you been vaccinated? How's your family doing? And then the gentleman, he said, oh no, he's not into vaccination, right? And so we got into a conversation about, he told me why, like how he was feeling. He said, oh, that's no good. Like, never mind. I'm not gonna do that because, I don't go anywhere. And I looked at him and I said, but you're out here. You're out here talking to me in public, right? And I had told him, I said, because you're negative, think about getting vaccinated today. Because he said he had a family, he had children, he had young children. And at that time, there was no vaccination for the younger children, right? The 5 to 12s at that time. And so after some conversation and just, I think, relaxing with each other, then he went over, and I walked him over just to make sure. So I walked him over to the vaccination site, and he did get vaccinated. And I think it's those small steps that we take where we feel successful, and it helps us in our communication with people, to just open up to them and just help them feel comfortable that they can share their stories with us. And so, yeah, that was a success story that I can remember that happened to me. Yeah.
Yeah, same with Holly. There are many stories, I'm sure, our public health nurses have. Unfortunately, we could only capture 2 of them on here. If we could, I think that'd be one of the things that we could do is gather all the stories from all the public health nurses, because we have she had said up to 70. So I'm sure there's many stories, but again, even for the people who don't want to engage sometimes, who don't want to talk. I mean, it is just about saying, okay, you don't agree with the vaccination. So it's okay, but what are the other things that you're doing to protect yourself? Tell me, let's talk about that. How's your distancing? Are you wearing your mask? What are the other things that you're doing? So there are other ways, if they're really against vaccination. We don't only talk about vaccination. We do many, and yeah, it could be where they don't want to talk that day, but the next time, there's we don't want to close that door. So, so thank you for talking with me. So even those, we find that those are good stories too, because eventually, hopefully, depending upon what happens to them, in their own personal life, maybe they will become open to the vaccination a little later. So just getting in there and talking. Those are our little successes, I think.
Yeah, those are the unwritten or undocumented successes that outreach workers just have tons of, right? You guys should start a podcast. I'm sure you have a lot of followers for that. Yeah, and sometimes that's what people need, right? You just need to talk story. And as you mentioned in your presentation, there's just such a lot of misinformation out there, and people just need to talk it through to kind of get the critical pieces that they need to make that decision to vaccinate or not. I think people are just generally scared, and if they just have that opportunity, and the outreach workers like you folks, really provide that space for them. So mahalo for that. Let's see. The next question is, outside of COVID-19, what other needs are voiced and how do you address them? So I guess outside of, in your vaccination clinics, are there other needs that come up that you're not expecting, but you have to address at the time?
I have to think about that. Yeah. That's a hard question. There.
It's okay. It could be, it's just.
So we're so focused on our COVID-19.
Other needs that come out of the outreach that we discover?
Yeah.
Sometimes we see the need for people to have access to care. So it may not be just related to COVID-19, but how that has come up in the past is when the question has been asked about the cost of the vaccine, right? And they think that because they don't have health insurance, they can't get the vaccine. And so then that leads us to a conversation about getting health insurance, right? Referring them to one of the federally qualified health clinics or one of the low-cost clinics who can assist them with getting health insurance, because we try to I guess help them understand the importance, especially when they have keiki, right, in their home. We want to make sure that they're getting their annual checkups, that they have someone to go to when they have questions, when the kids get sick, not only with COVID, but just anything, and to establish that relationship with a physician, with a health center. And so that has come out where it's different. It's not just COVID, there are other things. And then, so that's why the talking story is so important, because as their defense kind of lowers, then they start talking a little bit about, their life. And then we see, okay, we can help them with something else. And so that's the beauty, I think, of public health nursing. We can help them in so many different ways.
Oh, agree. There's so many valuable touch points that you guys provide for our community. What are the main barriers to people getting tested or vaccinated for COVID-19, do you think?
I think testing is, they're making it quite easy now. Right now, there's a lot more testing centers that are open. There's access to the home test. How we had we share the COVID-19, USPS government.gov site. Testing, I don't see too many barriers at this point, but vaccination, what I'd say, speaking from my point of view, it becomes a very individual decision for each person in family. We really couldn't, I can't pinpoint the exact reason why. It really takes that whole, like Holly said, talking story with them to try to figure it out, because a lot of times you'll hear that, oh, well, you know, my cousin's auntie got the shot and she had heart problems. So, you know, through that conversation, then you talk about, okay, you know, that may or may not have been related to the shot, to the vaccination. It could have been that she's already had heart problems, you know, versus, or if somebody says, you know, like, or someone else got sick from the shot. It's about then talking to them about side effects, right? Normal, common side effects. That's okay. You know, that just shows your body is working. So yeah, it's very individual for me, in my opinion, when I speak to somebody about why they don't want to get vaccinated. Yeah, what about you?
Yeah, I think the same. I think we really, you know, there's so many, I guess, factors in deciding whether you're going to get vaccinated, what I've learned from people. And so sometimes we have to put ourselves in their shoes, what their family life is like, what their support system is like, right? What's going on in their life. And then, like Jody had mentioned before, right? Maybe they're not ready right now, but we have seen the same person maybe a couple months later, and they've remembered us, you know, and they'll tell us, you know, at that time I wasn't ready because something was going on in their life, right? But then later on, after they kind of thought about it, got more information, and researched themselves, that they decided to get it. And so, I don't know, I think that's rewarding for us who have gone out for outreach to see that. And yeah, it's timing. It's when you're ready, when you feel like it's time for you, whatever your circumstances are, yeah, because we're all different people. I mean, we have different reasons why. None better than the other, but you know, that's just how it is sometimes.
And providers have been really great, like HPH, Kaiser, the providers, the vaccination providers like Queens we've been working with. They make it really darn easy to get the vaccine. You know, they partner with us at some of our larger Hawaii Public Housing Authority properties. And so it's just like, okay, guys, you know, there's a vaccination clinic here today, right now going on. You know, we have flyers and hey, how about getting it? So yeah, that's definitely not a barrier, I think. You know, these providers are making it very easy for the public to get their vaccinations.
Oh, thank you. I think, you know, as public health professionals, we know that sometimes behavior change just takes some time, and it just depends where an individual is on their timeline for change. So totally understandable. Running to the last couple of questions, but how can we support the work that you're doing?
Well, it's always good to have, I guess, people from different programs, from different walks of life, yeah, helping us with the outreaches. And so we can suggest or actually recommend that they volunteer through the Medical Reserve Corps. If they sign up, you know, they can get all the information. And then, so during our outreaches, we always ask for help through MRC. And so there are volunteers through MRC who come out, they outreach with us. And at first they're a little hesitant sometimes. They're not sure what to expect, how to answer questions, but you know, it's a learning process for all of us. And so I think that's a great way to volunteer, come out, help us see what it is. You know, sometimes you know people in the community and you can talk to them and then they talk to somebody else. So yeah, volunteering.
And like we said, we do provide a pre-briefing, which includes just-in-time training. So yeah, so that way, you know, people from all walks of life.
Yeah, thank you. I feel like I can talk to you guys forever, but Thank you so much, Jody and Holly, for being our guests today. Even prior to the pandemic, the work of public health nurses is just so valuable to our state. So we commend you and extend our gratitude to all the frontline workers who put their lives on the line to keep our residents safe and informed. So thank you all of you in Zoom world for joining us today. I want to thank all of the Hi-Fi staff behind the scenes, helping to ensure that these webinars run smoothly. And our next webinar will be April 6th with more information to come. We'll be sending out a post-webinar Mahalo email with some of the presentation links and the videos that you didn't get to hear from Lance and Kavehi. So you'll be able to hear those stories from the field. So thank you both and mahalo. Bye.